Okay, hello Miss Grill. Okay, my name is Kathleen Pablo and I'm gonna be your student nurse for today. Okay, today we're gonna do a physical assessment on you from your head to toe. Before we start, can I verify your full name please? Michelle Grill, okay. And your date of birth? Okay, good. Before we start the head to toe assessment, is there anything that I can do for you? Do you need assistance on the restroom? No? Okay, good. Okay. I can see that your overall appearance is good. You don't look depressed. You look well groomed and well dressed. Okay, and I don't see any ongoing therapies around you, such as like IVs or oxygen that can hinder our assessment. Okay, now we're gonna start. Okay, I'm gonna assess your skull and your head. It's normal in size, shape, and symmetry. Okay, your hair. Okay, I'm gonna go behind. And your hair is also good in texture, good color. There's no lesions, there's no lice. It's not too oily and it's not too dry. It's good and very good distribution of your hair. Okay, and your scalp too. I'm gonna feel your scalp. I don't see any lesions in your scalp. There's no bulging. Okay, there's no inflammation in your scalp. Okay, good. And now I'm gonna assess your face. Your face is symmetrical. Your face is symmetrical. There's no drooping on one side. And I'm gonna feel your skin in your face, and it's nice and warm and dry. Okay. And I'm gonna look at your eyebrows. Your eyebrows are full. It's also symmetrical. There's no lesions. Okay. And your eyelids, I'm gonna feel your eyelids. Okay, it's not tender and it's also symmetrical. There's no scars or no lesions and inflammations. Okay, I'm gonna feel your lacrimal sac to see if it's tender, and it's not. There's no excessive tearing on your eyes. Good. And then I'm gonna go inside your eyes. I'm gonna check your eyes. Okay. I'm gonna look underneath your eyes. Okay. I'm gonna check your conjunctiva. It's pink and moist. Okay. And your sclera is also white and moist. Good. And I'm gonna assess your pupil. Your pupil is brown and round, and it's equally round. It's also symmetrical. I'm gonna put a light on your eyes. See the light reflex is symmetrical. And I'm gonna light and see that your pupil converge and constrict if I shine the line on it. Okay, good. And now I need you to look at my pen, okay, and follow it. And then I'm gonna test your oculomotor eye movement. Just follow my pen up, there, okay, good. Okay, good. And now I need to test your vision. So I'm gonna hand you this card. Can you please read the first two lines of the card? Good. Okay, your reading is good. And now I'm gonna feel your temporal pulse. You have equal pulsation in your temporal pulse. Okay, and then I'm gonna look at your ears. It is aligned with your eyes. It's also symmetrical. I'm gonna feel it. There's no skin breakdown. There's no lesions. And it's not tender. And there's no drainage on your ear canal. Okay, and I'm gonna feel your tragus. It's not tender. Good. And then I'm gonna assess your hearing. Okay, I'm gonna go behind you, and then you tell me where you hear the stuff, the sound. Okay, on your right, on your left. Okay, so the hearing is done, and now I'm gonna look at your nose. I'm gonna assess your nose. Okay, it's also symmetrical. There's no deviation in your nose. Okay, and then I'm gonna look in your nose, inside your nose. I'm gonna look at your nasal. I'm gonna assess the patency of your nares first. Okay, I'm gonna close this nostril down. Okay, I need you to breathe, and I'm gonna close this one and breathe. Okay, good. I'm gonna look inside to see your nasal septum. Okay, it's straight. There's no deviation in your nasal septum. Your mucous membranes are pink and it's moist. There's no inflammation. There's no lesions inside. Okay, good. And then I'm gonna assess your frontal and your maxillary sinuses. There's no pain. There's no pain. Okay, good. No tenderness in the sinuses. Okay, now I'm gonna look at your mouth. Here, I can see that your lips is pink and moist. It's not too dry. There's no flaking. There's no crack in your lips. Okay. Then it's can you smile for me? Okay, good. Your smile is symmetrical. And I need you to open your mouth. Okay, good. All your teeth are present. There's no cavities in your teeth. Your gums and mucosa are pink and moist. It's good. And then I can see your pharynx too. And your hard and soft palate is also pink and moist. There's no inflammation or there's no lesion inside your mouth. Okay. And then I need you to say ah. Okay, good. The uvula goes up and down when you say ah, and it's midline. Okay, and it's also symmetric. There's no enlarged tonsil. I don't see any enlarged tonsils. Okay. Now I need to look at your tongue underneath, and then the surface of your tongue. Okay, good. And it's also moist and pink. Okay, I need you to move your tongue side to side. Good movement. Okay, good. And now I'm gonna assess your neck. I'm gonna look at your neck. Okay, your neck is also symmetric. There's no swelling. I'm gonna feel it. It's also nice, warm and dry. I'm gonna palpate your lymph nodes.
Yeah, come here. Hey, no.
Okay, there's no swelling. And now I'm gonna do your pulse.
I'll punch her in the face.
And then I'm gonna palpate your pulse, your carotid pulse. Good. And the other one. And I'm gonna listen to it. Okay, I don't see any sound. There's no brewing. Okay, good.